Hi, good afternoon, and welcome to this short talk on the COVID wave 3 and children. A dozen ways to protect your child. I am Dr. Jagdish Chinnappa, the founder of MedTrain Bangalore, which is a medical training company, and I also am the cluster head at Manipal Hospital, Bangalore region. What we will be discussing in the next few minutes will be the impact of COVID wave 3 if and when it happens, and what are the preparedness that parents can take in this kind of a scenario. The story starts early this month, around May 5th, when the chief advisor, scientific advisor to the Prime Minister, Professor K. Vijayaraghavan, came out with a statement on May 5th saying that the COVID third wave was inevitable and it is going to predict, but one can't predict what timing it's going to happen and when it is going to hit our population. Very soon after, on May 7th, that is 48 hours afterwards, the language changed from inevitable to may not happen. So there was some degree of ambiguity on whether it is going to happen or not. However, with the caveat that we should take strong measures to see that it doesn't happen. He also goes on to say that it may not happen in all places. It may happen only in some places. And it will also depend upon how effective the local governments are in preventing this third wave. Well, another expert also from the government side, this is Professor Vidyasagar from the IIT in Hyderabad. He goes on to say that there is going to be a wave or a pandemic in about 6 to 8 months' time. And this he bases on a very interesting model which the government has been following called the Sutra model. We will discuss what the Sutra model is. The Sutra model is a mathematical modeling which has been taken part or rather which has been put together by the IITs at Kanpur and Hyderabad. And Sutra stands primarily for the whole spectrum of how COVID affects people. The susceptible group, the undetected group, the tested and positive group, and the removed approach of those who have either recovered or died. Now, Sutra is purely, it works on looking at various variables as far as the environment and the virus and the host is concerned. So it looks at various parameters there. It has been blamed, the Sutra has been blamed for not predicting the second wave. However, the proponents or the people who are behind Sutra go on to explain to us that the third wave is going to happen sometime when our festivals take place. And in India, this is a big time where there's a lot of social activity happening. There are people who mix together, there's shopping that happens. So this usually is during the months of August to November. And the predictions are that we will be hit by the third wave somewhere at this time. Now, another very interesting thing is, what are these waves? Now, waves means, as you can see, when you go and stand in a seashore, there are waves that come and hit you, right? You can see the waves, the first wave comes, then the second wave comes, then the third wave comes, then the fourth wave comes. Then you have various waves that come in. Corona started somewhere in March of last year. It's a brand new virus to our population. There are many variants which are come across now, and there's always a wave of an increase in infections and illness. So if you go to the coronavirus itself, the coronavirus is a virus which is basically an RNA virus. It's got various components. I don't want to complicate it too much, so I'm just going to say that it has got basically three kind of groups of things. One is it has got the nucleocapsid protein, or the protein which is there, which is the RNA protein. Then it's got a membrane protein and a spike protein. Basically, these are the three proteins that this virus has got. Now, the very important part of this virus is that it has got a particular spike protein which goes and attaches itself to receptors in many organs in the body. Primarily, it affects the upper respiratory and the respiratory tract, but these ACE2 receptors in the body where this protein goes and attaches, or this receptor goes and attaches, is spread across many parts of the body. That is why in some patients you may not get mainly respiratory symptoms but cardiovascular symptoms. Some of them may even get gastrointestinal symptoms. So symptoms can be there in many organ systems because ACE2 receptors are pretty widespread through the body. Let's look at Bangalore. Last year when you saw this wave which started, we started in March and slowly the cases built up. We had lockdowns. As you know that there were a lot of lockdowns last year. And as you can see in this chart, the wave starts going up. As you can see, it peaks at around about somewhere in August, August, and then starts coming down. And it has come down quite significantly till February of this year. Now, this is the first wave. We are now in the midst of the second wave where the disease again goes up, and then it will come down. And then we will have another wave coming in. Now, what are the determinants of this rise and fall? Determinants are many. The first thing is, remember that this is a virus which is hungry to get a susceptible host. So, when there is an infection, there is a large amount of infection in the population produces antibodies. And these antibodies will protect the population from the virus spreading rampantly. As days go by, the antibodies start coming down, the susceptible population start mingling together again, and again there is another wave. In the meantime, the virus also is smart. It doesn't remain the same old virus which came sometime in March. It changes its character because the virus has to survive. It's the survival of the fittest. So what the virus does, it starts changing its identity. It creates a fake identity by producing mutants, producing variants. So there's mutation that keeps taking place, and this kind of mutation then will start propagating in the susceptible host. Remember, many times patients who have been infected and who have had the disease before would have developed some immunity, but this immunity is not either long-lasting or protective of all variants. And therefore, even if you have had COVID before, you may land up getting COVID again. It's not as if that you can have, once you're infected, you won't ever get it because the virus is changing, your host immunity is coming down, and therefore, it's always wise to be safe. You can see this is the New York Times, which has given the surge of cases in India. And as you can see, started off sometime late February, March, and then started going up and up and up. So we are now riding the wave on top. Of course, if you look at the chart again, the cases in Bangalore have gone right up. We do not know whether we're going to go still up or down, but the tendency looks like in this day, that is the 25th of May 2021, looks as if that we have probably reached somewhere near the peak. And now we should start looking at the fall. This is the chart which is shown somewhere in May 24th. And as you can see, Karnataka still is a very, very hot spot because of the number of cases compared to the rest of the country. Now we know that the third wave may come, may not come. We do not know how big it is going to be. It is going to depend on how many susceptible hosts are there, how bad the mutations have taken place, and of course, how much of mingling takes place so that the virus can spread quickly. So these are the things that will guide how bad it's going to be. The key question which is on everybody's minds, will the third wave affect children disproportionately? The straight answer I can give you is we do not know. Let's look at what the Indian Academy of Pediatrics says. Wave 1 was targeting predominantly the elderly and those who had sickness, that is the adults who had various forms of diabetes, hypertension, obesity, or they had many malignancies or any other kind of long-term chronic disorders. So the first wave affected them. This wave, because most of the elderly have had the infection or the vaccine, they are no more really susceptible. We now have a movement downwards. And you see young adults. Now this time, very surprisingly, we are seeing many young adults in the age group of 30 to 45 who are quite significantly affected. The virus, because the most susceptible are there. These are the people who keep going out, who keep mingling, who go to parties, who say, oh, this virus is just another flu. So this is what happens. So the virus has now got a susceptible population to work on. As days go by, the third wave, it is predicted, which we do not know when it comes. We expect that a large number of this 30 to 45 already would have had either the disease or the vaccine. And therefore, now who is more vulnerable? It will be the adolescents and the children. And that is what the Indian Academy of Pediatrics feels we should be prepared for. So this is a very important concept to keep in mind. Now, is this borne out by facts? Well, look at what CDC says. CDC is the Center for Disease Control in the United States of America. Their May data says that COVID-19 cases amongst the youngest surpasses those in the above 65 years. And so therefore, there is a rise in the number of cases in young children, even in the United States of America, which is probably going through its third wave now. And this is again shown in this graph where you see in children who at the bottom, the right I can see, you can see that the rise is quite exponential. So therefore, we may be in for more number of children getting affected in the subsequent waves which come after the second wave. Now let's come to how dangerous is it? Because we know that many children will be affected. Well, look at what happens with COVID in children. The vast majority are either symptom-free with no symptoms or very mild symptoms. And you must have seen many children just getting fever for a day when there's other people in the house with very bad COVID. They escape. Most of them will escape. About 8 to 10% or 20% maximum in some studies, which has shown that they have moderate disease. And a small percentage, a very small percentage of about 1 to 3% are the ones who will go in for severe disease. This is another interesting chart which shows again that the relative risk of cases, hospitalization and death less than in small children is very, very, very less. And therefore, this is of course a little dated data, but it shows you again that children generally escape getting into serious disease. Now, what are the features of mild disease? Mild disease presents most often with fever, cold, cough, vomiting, loose motion, stomach pain, headache, body pain, and sometimes rarely children can get confusion or kind of delirium. Usually there will be a contact at home and antigen testings will be positive. We'll come to the testings a little later, but usually this is the pattern of a mild disease. These children will suffer for maybe a few days and then recover uneventfully. This is the normal course of the vast majority of children. Whether we have a third wave, second wave, first wave, whatever wave, disease in children is likely to follow this pattern. And the reasons are many, basically because they probably do not have too many ACE receptors which can pick up the spike protein in the virus. So that may be the reason why they're relatively spared. Then we come to the moderate disease. Moderate disease usually is a progression of the mild disease. It doesn't come de novo. The child usually is unwell for a few days, but is worsening. This is not the child who starts improving on day 2, day 3. If the initial test was negative, then your antigen test will come positive here. Most important, these children can be recognized if you can pick up deranged vital signs. What do I mean by deranged vital signs? They will have temperature which is either persistent or high. Two, they will have a heart rate which is more rapid than what is expected. They may breathe fast. They look ill. They don't feed very well. And if you objectively measure their pulse saturations, their oxygen saturations by the pulse oximeter, you will find a saturation which is less than 94 and which is a problem. Some children will go in for severe disease. As I said, this is only 1 to 3%, is rare. But if you see lakhs of children getting COVID, then this becomes a significant part of that 1 to 3%. Here, there can be two kinds of problems. One is when the virus enters the body, it causes a severe infection. Here, the children tend to get worse. They can get breathless. Their saturations can go pretty low. They can get retractions. They may say grunting around. They can get blueness and their fever may be very high. Some of these children also can go in for convulsions. Some children also may look like appendicitis with very severe abdominal pain, vomiting and loose motions. The other group of children who tend to get very severe disease are those which are immune related. What is meaning of immune related? Immune related means the virus is coming, the body's immune response is excessive. Now, my teacher used to say that if the attacker and the defender are not very strong, then nothing happens. But if one of them is strong, it will overwhelm the other. Here what happens, the immune response is very strong. So it tends to not only attack the virus, but attack the body. And when it attacks the body in different places. It attacks the body by producing inflammation inside the body. When this inflammation happens, you immediately start getting fever again. These are children who could have recovered or in the process of recovering, who start getting high fever. In addition to that, they also may land up with inflammation around their eyes, which produces redness, inflammation around their mouth, inflammation around their tongue. They can also get inflammation on the skin. But what is more dangerous is the inflammation that takes place inside the body. And what of this inflammation that takes place inside is primarily it affects the heart. Now, because it affects the heart, it's a very, very dangerous condition because these children can present with heart failure and shock and may even die very soon. So it's very important to pick up these children very quickly and reach a medical facility. Some of these children also may have convulsions. Some of these children also may have low urine output. So it's very important for the parent and the caregiver to recognize the progression of a mild disease to moderate and severe, or a child who is recovered from a COVID disease and then lands up with an immune-related problem. So I think these are some of the clinical manifestations all of us should be sure. Well, now we have talked a lot about what corona does, how the waves come, how the clinical manifestations are, and how most children escape it. Now let's see what parents can do, what we can do. And this is the crux of my talk. I would like every parent to please keep a checklist of these 12 items. This is all they need to know, because please remember, taking care of children is a partnership. It's a partnership between the doctor and the parent. It's a partnership between the medical care system and the family healthcare system, because we cannot survive without each other. We cannot get the child better without each other. We can only do things when we do things synchronously. Therefore, please keep this list of 12 things with you whenever a child with COVID is diagnosed. It's important to realize that all children are not the same. There are basically age bands. Children less than 3 have to be handled very differently from children who are between 4 to 11 years and in adolescence. They have different needs. They have to be cared for differently. And please remember that small children will progress fast. Older children will give you time. Small children won't talk, older children will. So it's very, very important that small children are monitored more frequently than older children. With older children, will give you time. They'll tell you, yes, something is wrong with me. As we said, the course of the illness goes through this phase. The first step is exposure. Second is infection without any symptoms. This is what is called as the viral multiplying in your body. Then you start getting symptoms. When the infection is there, it builds up, and then there's a recovery phase. So this is the normal pattern of illness in everybody. So I'm going to divide care into two groups. One is the pre-COVID, or the time before COVID strikes the family, and the time when COVID strikes the family. The post-COVID, that is a recovery phase, I am not going to discuss because that is not a major issue that needs to be discussed right now. That's an important part, but that can be individualized and managed with your pediatrician whenever it is required. Let's start with the pre-COVID period. What should you do before the child gets COVID? The first thing is, please remember that the single most important way you can prevent or reduce the impact of COVID is by non-pharmacological interventions. We always know about masks, distancing. What about children? Well, children about 2 years, masks are recommended. We'll talk a little bit about different types of masks. Hand sanitizing and washing is very, very important. Children should be taught. Other important thing is, do not go to crowded places. Do not allow your children to go and play downstairs, because children, when they play, they are in physical contact. They don't wear masks. They will definitely pass on the infection. Another major way children can get infected is use of things like, lifts. Infections in lifts is very, very common because it's a closed space. And there are many people breathing in, breathing out. Somebody doesn't wear a mask properly. One infected person can infect more than 20, 30 people in a crowded lift. So be very careful. Use the stairs. It's good to also to get fit. In the community setting, recommendations are children about 2 years should wear a mask. Nowadays, everybody is talking about what is called as double masking. Double masking means there must be 2 layers in the mask. And it should fit snugly. It should cover the nose and mouth, and it should be comfortable. And please, the steps for wearing the mask are given in this chart, which I will share with you, whoever is interested. Basic thing is, before wearing the mask, wash your hands. Do not touch the surface of the mask at any time. Pull the strings out and put it around your ears. See that it covers your nose and mouth. Let it be comfortable. When removing, be careful that again you don't touch the surface of the mask. When the child is well, that is still in the pre-COVID period, before the COVID period, learn to measure. Simple things. Take 10 minutes of your time. Measure the temperature. Learn to measure the pulse. Measure the breathing rate. And learn to use a pulse oximeter. These are very, very important things. Simple things. A good thermometer. Learn to take the pulse of the child. Look at the breathing rate and the oximeter. Temperature you can measure in any way that you think is convenient. It can be any thermometer, but check it when the child is normal so that you know what is normal for the child. You can use a digital thermometer. You can use an oral thermometer. You can use don't use a strip. Other than that, any other thermometer is fine. The pulse is simple. Just check the pulse on the radial part or in the hand. It's very easy. Mothers can do it. Just keep your watch next to you and monitor the pulse rate. Breathing rate, just allow the child to lie down comfortably and watch the movement of the stomach up and down. Keep your watch next to you and just approximately see how many times the child is breathing. The pulse oximeter, we will discuss a little later on how to use the pulse oximeter. Train the child also, if it's an older child, to just chart. Whatever you look at, let the child enter in a color pencil. He will feel good about it. Keep physical distance. What is physical distance? 2 meters. Many people don't know what is 2 meters. Okay, so see the distance. Hand washing, very important. Many videos are there. Another thing you can do in older children, especially above the age of 10 years, is to try and allow them to sleep for some time on the stomach. Don't try this with small babies. It's dangerous. Set up a consultation with your pediatrician. Even when the child is normal, just to run through these points if you have doubts. And very important, complete all routine vaccinations. Recently, there was some talk about influenza vaccine. Please remember, influenza vaccine is routinely recommended for children under 5 years of age. Okay, above 5 years, it's not a compulsion because children do not really get into too much problems with influenza. Influenza vaccine will protect only against influenza. Influenza vaccine will not protect against corona. Please understand this. So, influenza vaccine is a good idea. Small children, however, it will not prevent corona. Okay. Pulse oximeter, very important. These are very good guidelines. It's there on the BBMP website. What you need to do is to see that the hands are warm. Make sure that you don't have any polish, nail polish or anything on the finger. Put the pulse oximeter on top, switch it on, check it and put it on these two fingers, either this finger or this finger, predominantly of the dominant hand. Use the dominant hand only as far as possible. In children, of course, it doesn't matter, but in adolescents, you may want to use the dominant hand there. Then allow it to remain for some time till it stabilizes. Many times, parents will put it in and remove it very fast. Please don't do that. Allow it to remain there till it remains constant. Suggestion is usually around 30 seconds to a minute is a good idea. Then look at the reading. You must see the pulse waveform. After you see the pulse waveform, look at the reading. It will give you two readings. Basically, that's all you need to look at. Don't look at the other. There are many other derived readings. Don't look at that. Look for basically what is the oxygen saturation in percentage. What is the pulse rate. These are the two things and note it down. This is a simple test that you need to do with the pulse oximeter. Another test you can do, of course, is the 6-minute walk test. What is a 6-minute walk test? Very simple. Check the pulse oximeter readings when the child is sitting or quiet. Allow the child to walk for around 6 minutes, preferably brisk. Again, this is useful in older children about 10 years of age. Under 10 years of age, it's extremely difficult to make children walk for that much amount of time, especially if they got, the fever. But practice this. Make them walk and check the saturation. Generally, the saturation should not fall by more than 4. If it falls more than 4, then you definitely must contact your healthcare provider. Sometimes you get a call of a child who is otherwise very well, but the saturation is low, of let's say 85 or so. Many reasons. First and foremost, you must check the saturation against your own hand. 1. If it is also showing low, that means there is some problem with the pulse oximeter. The second thing is change the batteries, because many times a battery which is not fully charged will not give you a correct reading. Point number 3, vaccinate all eligible adults against COVID. This is very, very important. I get calls from parents these days very often. Doctor, should I take Covishield or should I take Covaxin? Well, most important, whichever vaccine you take, whether it's Covaxin, Covishield, doesn't really matter. We are going to get the Sputnik Light. We are going to get many other vaccines in the next year. Really doesn't matter, because the purpose of vaccines is to prevent serious disease and death. You can still get COVID after vaccination. Very common. But usually they are very mild or they do not get you into the ICU. So please give it. Another important thing is when vaccines are licensed for children, give it. Don't have all these numerous messages on social media about children and vaccination and this and that. Please remember, follow the scientific community. There are a large number of people who claim to be doctors and who claim to give you different types of, complementary therapies, okay, which are, in my opinion, to be looked at with an enormous amount of suspicion and skepticism, because ultimately the only system of medicine that has got rigor, that looks at stuff and discounts it and says, yes, we tried this, it didn't work, is the allopathic profession. You very well remember the case of the hydroxychloroquine. Initially, we thought it was a great drug, but when we found that it was useless, we have stopped using it. So I think self-correction is a feature of all allopathic medicine. And I think as evidence accumulates, please be up to date. Please talk to your doctor and see the issues. Another important thing which we come to is number 4, do not be afraid to test. There is a syndrome, or there is a peculiar feature in our communities called pushing under the carpet. What we do is, oh, no, my child can't get COVID. After all, he's not gone out anywhere. He's just got some cold, cough, fever. Nothing great about it. This is a normal response because they don't want to test. One, because they fear the test. The second thing is there's a fear the result. Supposing COVID is positive, then I might have this problem, that problem. Then what do I tell my neighbors? What do I do? This, that, and all those things. So that fear comes in. But please understand, testing is a very important part of caring for the child. If you do not test, you will not diagnose early. If you do not diagnose early, you cannot manage early. There may be slight discomfort. Yes, every testing process will have some discomfort. But talk to the child. Talk to the child and take the child to a child-friendly place where samples can be drawn. The other thing is I have found is that taking a tab with a cartoon is extremely stress relieving for a child. The favorite Bugs Bunny character running around will keep the child relatively unscared of for most of this testing. What are the types of tests we do? We do basically 2 types of tests. One is we test either the virus or part of the virus by doing what is called as the antigen-based test. The famous RT-PCR is an antigen-based test. We also have a rapid antigen test, and we also have a gene expert test. All these tests have their place. You do what your doctor tells you to do. The antibody-based tests are usually positive in the recovery phase. Please do not keep doing them in the initial phase. And please do not do tests on your own. Important for you to talk to your doctor, get a prescription, and go and do the appropriate test for your child. This again is one more chart which tells you the same kind of testing. In addition, your doctor may want to test for different parts of the body in certain cases. We won't go into that now. You must have heard your doctor asking for a CBC or a CRP, or maybe doing a renal function or a liver function or some kind of a testing there. So important thing there is to do the test with the guidance of the doctor there. Recently, there is what is called as a home testing which is available. This is available for children about 2 years of age. Very new in the market. It will probably be available in the next few months. So I just thought I'll bring it up here. Next is, you have done the test. The child is returned as positive. He is now COVID positive. First thing you do is remain calm. Do not over-sensationalize the issue. Don't make a big issue out of it, talking to this person, that person, oh, my child has got COVID, this, that, what should I do? Panic, call the doctor immediately. Even if it is, I get the test, let's say 9 o'clock in the night, I call my doctor and try. No, there's no need. Cool down. You might get a call from the BBMP because all positive tests are followed up by the BBMP. You also need to note down 2 very important numbers. One is what is called as the SRF, the other is what is called as the BU. The SRF is a 13-digit number. This is your specimen referral form ID. That means the testing that you have sent is positive will be in an SRF number. The other number which is important is the BU number. The BU number means that you have a Bangalore urban 6-digit number, which is very important when you want to get admitted. We'll look at this a little more in detail. Another third important thing to note is what is your zone. Many people don't know their zones. So Bangalore BBMP has been divided into zones. So determine your zone, because if you need to contact the BBMP, this zone is very important. Another very important site is Karnataka Fights Corona.org. A lot of information and resources are available at this website. You need anything, go there and check it out. So this is the SRF ID. You can go to the covidwar.karnataka.gov.in and look at this. It will give you more details on what this SRF ID means. Also, helplines are there. You can see the zones here. You can see the unique number there, 1912, which is your helpline. This is a helpline which you can call anytime for any issue that is related to COVID. The BU number is allotted to every patient who has tested positive. Sometimes even patients who have not tested positive by RT-PCR but who have been tested positive by a CT scan, okay, will have a BU number. But it's mainly meant for people who want to get admitted in a hospital in the Bangalore urban area. You know, hospital beds are limited. So when you want to get admitted, this BU number is extremely important. This is a website of the Karnataka Fights Corona.org. They also are on Twitter. Please go to this website. Please also you can follow them on Twitter for updates on the services that are available. As we said, most cases are mild or asymptomatic. Do not panic if the test says COVID coronavirus 2 positive. Waiting for a day and contacting your doctor is a very good idea. Please remember, if you are calm, the child is also calm. Please understand that the children these days are in for a lot of psychosocial issues. They can be clingy, they may not have attention, they are irritable, they may have lots of worries, they may have sleep problems. So please do not add to this stress because they perceive COVID very differently. They have seen images which are not supposed to be seen by small children. And they're so scared of this disease. The moment you say it, the next thing is they're worried about so many unfortunate things that have happened. Again, as I said, watching the child carefully over the next few days is very important. Simple charting 3 times a day of what you have learned before: temperature, pulse, breathing rate, saturation, and 6-minute test. Another important thing to monitor is the urine output. Send it to your doctor on a WhatsApp. This chart can be sent every day in the evening at a fixed time. Your doctor can review it and tell you if there's a problem there. Number 7, isolate the child from those who are likely to get severe disease, even if they are vaccinated. Especially the elderly, people who have got some illness, and another thing is obesity. Please keep away children from anybody with any of these issues. By illness, it could be chronic illness, diabetes, hypertension, renal disease, malignancy. We have gone through that list before. So keep them away. Next is home isolate the child. When you are home isolating the child, there are now guidelines given by the government. Small children should be there with the parent all the time, and the parent must have an N95 mask. 4 to 11 years, you might leave them for some time independent, supervised, okay? And you can again meet them with an N95 mask. 12 to 18 years can be given more time independently and can be supervised occasionally. So these are some of the things that are guidelines which you can do it. The government of India has given these guidelines saying that the caregiver at home must monitor and be protected themselves. Very, very important. Some children who have got chronic illnesses themselves need to be home isolated because their risk in the hospital is pretty high. So therefore, it's very important for them to be monitored accurately and also protect the caregiver. Okay. Now, home isolation is preferable for 17 days. Some people say 15 days. Usually, children are not infectious beyond 10 days. However, since the recommendation is for 17 days, this is the toughest part. Because isolating children at home, at least as a practitioner I've seen, is a big challenge for parents. And the reason for that is because children are social. They want to come out, they want to play, they want to intermix, they want to. So therefore, it's very important to set up a kind of a video link so that they are in touch with the other members of the family. Try to fix an activity log. Buy adequate art material and keep it at home. Joint singing can be a good idea. Older children above the age of 10 years can be taught how to be mindful. Some mindfulness training can be done. Musical instruments, they can start learning something. Online Scrabble, I've just given some ideas, and maybe many more. Some permissive screen time, they should be allowed to watch a few things there. Ensure good sleep, and they all have their favorites. So teddy bear, the favorite teddy bear, is a great idea. Or even maybe you can buy a bear or a toy and tell them that this is a special Corona teddy bear to get Corona away. The point is children live in fantasy, and if you can fuel that fantasy in a positive way, nothing wrong in that. So maybe you should give them something they can identify with, play with, and which will help them get over the sickness. Number 10, do not give unnecessary medicines. I cannot stress more than this. The only medicine you need in the vast majority of cases is plain, simple paracetamol. Give correct doses and give it at correct intervals. Do not use anything else. There is no need for ibuprofens and naproxens and mefenamic acids and so many other brands are there. It's not required. Please do not use any of these. They have significant side effects. Even if you have to use them only on the advice and direction of a medical practitioner, not on your own. Immune boosters don't exist. Don't waste your time by giving zinc, vitamin C, D, etc., etc., etc. Multivitamins, zinc, so many things are going on, Ayurvedic. And speak to your doctor before administering medicines. Another important thing, nowadays you must have heard about the black fungus. The black fungus, one of the things is postulated is using too much of steam inhalation. So maybe once in a day or maybe once in, when you want to give some kind of a medicine, fine. If a child is coughing, a simple cough syrup is good enough. Don't try to get into any complicated medications. It's not required. Number 11, ensure optimal hydration and nutrition. Please understand that every fever will dehydrate. And maintaining a good fluid balance and a good urine output is extremely important in recovery. So sometimes it may be better to measure and see that the child gets that much fluid. On an average, a child who's about 10 kilos or under 3 years of age will need about a liter of water. A child, let's say in the preschool period and in school period, should take about 2 liters of water, 1.5 to 2 liters of water. And an adolescent should take almost 3 liters of water. And this rarely happens. So much of water is not ever given. So soups, juices, water, tender coconut water, whatever. Just see that the fluid intake is there. The other thing is regarding food. Children generally don't want to eat because they have fever and they're sick and some of them lose taste. They don't want to eat. So what is the best way? The best way is to create small morsels, frequent, small things. Like for example, maybe you can give them a custard or maybe you can give them a little dal chawal, maybe you can give them a little curd rice. So point is space it out. Maybe every 2 hours feed them. So that they will love. Biscuits, whatever. I mean, there is no issue here. Don't worry about body mass indexes for at least 2 weeks. See that they take adequate amount of nutrition, good nutrition, vegetables, fruits, and whatever you make at home, but frequently small quantities. Okay. Try to avoid constipation. See that they get a good amount of roughage and pass stools regularly. I cannot stress more upon this. Talk to children about their illness. They've got so many things going on in their minds about coronavirus. And I think it's very important that parents and doctors should talk to them. Get on a video call with their favorite doctor uncle. Talk to them. Let them listen. Let them talk and you listen. Reinforce their good activities and allow them to recover. There are many organizations you can reach out to if your child worsens. The most important is your family doctor and your pediatrician. There are pediatric departments in hospitals and emergency rooms in hospitals where you can reach out to. The government of Karnataka BBMP, I have given you the number there, you can contact them. A very interesting organization called Step 1, which will help you in triage, is available. Indian Academy of Pediatrics, Bangalore, will shortly set up a helpline for you where you can contact if required. Indian Academy of Pediatrics, Karnataka, also is planning to set up a facility for parents to call in. There are a large number of NGOs who are doing great work, Rotary and many others. And finally, you can go to karnatakafightscorona.org, which is a website which will give you a lot of information and places you can seek help from. So, friends and parents, this chart tells you what is important as far as the third wave is concerned. You can see from this chart 3 waves on the top part. These are waves which happened in communities. The green one shows only 2 waves. What happened to the third wave? Social distancing and vaccination obviated and got rid of the third wave. So how this wave is going to pan out is going to be determined by the behavior of every one of us. If we support vaccination, if we follow the social distancing, hand washing, masking, and teach our children to do the same thing, we'll definitely blunt the third wave completely. I will stop by saying that all of us from the pediatric community care for you. We care for you. We care for you and your children. We want you to remain healthy. And we assure you that your children are safe in Bangalore and Karnataka. And you can reach out to us at any time. As I've given you all the numbers there, we will keep posting more information. Please contact us and we are there for you and your children. So thank you very much for a patient listening. And if there are any questions you have, you could get in touch with the Indian Academy of Pediatrics at any time. Thank you very much.